the anatomy and how to examine the cervical spine nerve roots. We have 8 cervical spine nerves, and also the T1 is included with them as part of the cervical spine nerves. However, it's thoracic number 1, and this is because you have 7 cervical vertebra and 8 cervical nerves, and also the T1 will be thought related to the cervical area. So usually the cervical spine root is above its named pedicle, and that means the cervical spine nerve root number 1 is above cervical spine vertebra number 1. And you will keep counting until you come to C8, which will be above T1 or below the cervical vertebra number 7. So the examination can be clustered into C1 and 4 will be C1 to C4 will be examined together, but from C5 to T1 will have to be examined separately, and the reasons behind this will be explained clearly in this video. So starting by the outline of the lecture, as you can see, it's divided from C1 to C4, and also we have from C5 to T1 will be examined separately. In each subsection, we're going to talk about that each spinal nerve will have some sort of sensory supply, a motor supply, and on the other side, sometimes you'll have some reflex as well, but it's not going to be present in all of them. So we're following the same scheme for all the nerve roots. So for example, C6 will have motor, sensory, and reflexes as well. C7, we need to talk about motor, sensory, and reflexes. C, again, same thing, motor, sensory, and reflexes, but C8 doesn't have any part of reflexes, so we're not going to mention that, but you can still follow the scheme. And C1, it doesn't have reflexes, so it's only motor and sensory. All right, so that's our outline for today's lecture. Starting by examination from C1 to C4 lesions.